Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Here we are going to look at the mistakes, commonly common mistakes which need to be avoided while preparing. So what are the mistakes to be avoided? The very first one is the studying without a strategy. So without strategy. So this is a major mistake, and studying and reading randomly will lead to more and more confusion and will not help in the memorization. So memorization will be a challenge in this case. So what is recommended is, if you don't have a strategy, you need to go by a subject wise strategy. So the ideal recommendation will be to go by a subject wise strategy. So to form small targets and achieve a bigger one, that is, break the subject into multiple parts or multiple subjects, multiple mini subjects, and you can complete the portions. The next one will be to go by systemic approach. So by systemic approach, you can handle the entire CVS, and in a similar way, you can break the entire CVS into parts and then complete it as a whole, or say CNS in the similar way. The next important strategy will be to prepare the PYQs. So what is meant by PYQs? The PYQs are nothing but the previously asked questions or previous year questions. No matter which exam, MLE or NEET or INI or plab, we need to know the PYQs. We need to know the topics. More than PYQ, it is the PYTs which are important. So T stands for the topics. So any topic asked in that particular question should be answered. Next one is the taking the test, taking grand test. So the second one was PYQ, third one is taking grand test. So what is meant by taking grand test? Taking grand test is where you assess yourself, and assessment is by the exam pattern. So you have the same exam, the exam pattern. It's like a mock exam where you, after giving the exam, you get an analysis. So this analysis plays an important role. So what do you do with the analysis? Analysis, you can find out your weak zones. So by analysis, you find your weak zones and then you work on it and you make it stronger. So by making it stronger, your performance in the main exam is going to be far better. Next one is, the mistake is focusing on very rare questions. So if there is an exam, there are going to be bouncers. So what I mean by bouncers? Bouncers are questions which majority of the questions, almost all the questions, all the students get these questions wrong. So these are bouncers. So it is not ideal or not important to do bouncers. So you will be wasting your time doing bouncers, and a bouncer is a very rare question and it is very unlikely to be asked in the future exams. So don't pay much attention to these rare facts or bouncers. Next one is having a revision plan. So by a revision plan, you might have studied everything once, but you can't remember anything. So this is where a revision comes place. So after this, you revise again, and then you retain some amount, and then you revise again, then you're able to retain a more amount. So as all individuals are different, you might require 2 to 3 revisions, some might require more revisions, some might require just 1 or 2 revisions. So do it according to yourself. Next is, as far as the PYQs are concerned, PYQs are done. We discussed this. Next is to do more MCQ practice. So as soon as the PYQs are being covered and you're confident with the PYQs, you can move on to the major question banks and the major MCQs, where you practice the other questions, and more likely your practice of the clinical questions are very important. Next will be this is the last and this is the most important, is to take care of your health. So health is important. That is, you need to have say no to poor sleep. So you have to have good sleep, and Meals, focus on your meals, what you intake, avoid junk foods, and have a positive atmosphere. So all these are going to enhance your health, and enhancing your health, basically it improves your performance. So all these points added, you will definitely do much better and improve on your scores. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.